My name is Mark. I am a patient of Dr. Cubbage, as well as a staff member here at AOSM. Well, I have a long history with back problems. I've had previous surgery and I have psoriatic arthritis, and so I just have a lot going on with my spine as well as my musculoskeletal system. I started working at AOSM about 2 years ago after a career in fitness because of my health problems, because if you can't beat them, join them, right? So seemed like a good natural progression from fitness into medical. And I had my back under control through fitness, through yoga, Pilates, and core strengthening. And over time, the battle was lost, basically. I'm not sure exactly if there was any single event that triggered this latest issue, but it did come on suddenly. I woke up one morning with just lumbar, what we refer to as lumbar radiculopathy, other people call sciatica, just radiating leg pain, very little back pain, just mostly leg pain. And I tried everything in my toolkit to try and remedy the situation because I've been living with it for years. And it just persisted. So I saw Tim, Dr. Cubbage's excellent physician assistant, and we started with some x-rays. This is the first time Tim had seen my spine and said, wow, you got a lot going on there, buddy. Let's try some physical therapy. Let's try some medications. So we tried that. I gave that a good try, and then still no relief. So we ordered an MRI. The MRI showed that, again, I had many problems. And Dr. Cubbage said, well, here's the primary problem. It's like, yes, you have a lot going on with your spine, but this one thing is what's causing this radiating leg pain, which was, basically Facet arthropathy at L5-S1. And he said, it's a pretty simple procedure, outpatient surgery. Let me know when you want to do it. So I put it off for as long as I could until I couldn't stand it anymore. And then I spoke with Vicky about putting me on the schedule, and we got it scheduled. And I had what is called a lateral recess decompression of the L5-S1 left side. And I'm still in recovery. I'm about 2 months post-op now. I'm in physical therapy. My symptoms have mostly resolved. I still have some intermittent pain, but Dr. Cubbage is the best, and I know my care I'm well taken care of with Dr. Cubbage and his team. Dr. Cubbage, Tim, Vicky, Ashton, just stellar. Can't give them enough praise. So I'm doing physical therapy 2 times a week. We also have an excellent physical therapy department here at AOSM. And I've been working with Mandy and John, and they are helping me come along. I'm still doing my homework, as we always encourage all our patients. Your progress is going to be in a large part determined on how showing up for your physical therapy, but also continuing with your therapy when you're not here. We have a limited amount of time. We get to see the physician and the therapist, but we're with ourselves all day. So we have to keep up with it and be dedicated and determined to recover. And so it's coming along. Before, I literally couldn't stand it. I literally couldn't stand. I was constantly having to go down. I couldn't find a comfortable position. Lying down, sitting down. There was no escape. Only medication. The surgery was a no-brainer, and now it's maybe a 1 or 2 out of 10, whereas before it was probably 9 out of 10, 10 out of 10 on its worst. So huge difference. I am lucky enough to get to actually work with Dr. Cubbage and assist them as a medical assistant. So I get to see all sides of it, and they're just a great team. It's like Dr. Cubbage is very warm and personable. He's very funny. Vicky, likewise, is just a joy to work with, and it's all of them, Ashton and Tim, they're just a wonderful team. And whether you're on the patient side or on the assistant side, getting to work with them in any capacity is a blessing, I guess is how I would describe it. I would highly recommend Dr. Cubbage to anyone who's experiencing back pain or other symptoms of that can stem from the back, because that's the thing with pathology of the spine is sometimes the pain is not in your back. Sometimes it's in your arm. Sometimes it's in your shoulder. It can be in your leg. It can be in your glutes. You can feel it in your hip because of all the nerves that innervate out of the spine. So they'll pinpoint that and then come up with a conservative treatment first. If that doesn't work, then we can get imaging, physical therapy, and then surgery is always the last resort. They don't jump to surgery. It's like, hey, let's try everything else, and then when all other options have failed, we'll go with the surgical option. If you're experiencing symptoms, come in and see us so we can diagnose. And it may be, again, something as simple as some physical therapy, or an anti-inflammatory, maybe a lifestyle modification. Don't suffer unnecessarily, needlessly. That's what we're here for.